Good morning, SANUWAVE family. Great to have you for our second installment of our 11-minute vlog with Shri on behalf of SANUWAVE and our growing community. I have the pleasure of being with Dr. Desmond Bell out of Jacksonville, Florida today, who in a very admirable manner created a foundation which we look forward to supporting increasingly more as we grow together. And that's Save a Limb, Save a Life. But before we talk a little bit about that, Dr. Bell, can you please talk to us about what brought you into podiatry and kind of the early years of what your calling was to get into treating DFUs?
Yeah, absolutely, Shri. Thank you for having me. It wasn't really a planned course of my career path. You know, I was always interested in medicine from the time I was a little kid. And unfortunately, during college, I kind of talked myself out of it, even though I had been working in a hospital from the time I was 14, all through high school and college, between volunteering and being an orderly. But I kind of felt like maybe medicine was a little depressing, so I wanted to do something else with my life. But anyway, as it turned out, I ended up working for an orthopedic company, Zimmer Orthopedic. And while I was there, I was exposed to the OR and really enjoyed sports medicine and orthopedics. So I decided to leave the corporate world and go back and do my pre-medical studies. And it's just one of those things where I thought I was going to do the orthopedic route. Some things happened along the way that were out of my control, and I ended up finding about podiatry, and I just thought it made a lot of sense. When I entered podiatry school, again, I had no idea what diabetes was all about, or wounds, or amputation prevention, any of that stuff. So it was kind of like a little divine intervention, I guess. First year training in the VA in Philadelphia, I saw so many patients with diabetes and who were at risk for amputation, as well as amputees. Right. So that kind of got me on the career path, and I was able to have some good mentoring, people that encouraged me to do wounds, and I saw the need that was out there too.
Right, and if I recall correctly, the timeline was around the mid-90s, and complex chronic wounds clearly wasn't what we experience today.
No, not at all.
In terms of the management at that time, clearly we've had significant advances in technology, products, industry supporting what could help us better treat aggressive healing of chronic wounds. But what was your exposure to it when you decided to make the change to go back to podiatry, or get into podiatry after being in orthopedic work?
Yeah, again, it was not the whole idea about doing wounds. It was really, the idea that I could do surgery, sports medicine, orthopedics, and maybe have a more normal lifestyle, because I knew, kind of going back to school at a little bit of an advanced age, that there was going to be some type of imbalance possibly, and I just kind of thought it out. So just made a lot of sense. But really, my first year in the VA in Philadelphia, where I did my first year of training, I should say, it was really an eye-opener. And just to kind of put it in perspective where we are today, back then we had about 12 million people with diabetes, or 16 million people with diabetes, somewhere in that range. Now we're up to over 30 million. And I still remember one of my colleagues telling one of the newly diagnosed vets, don't worry, this is a good time to be diagnosed. We're really close to a cure. So, in terms of what we had to use in wound care and products and the way to go about treating it, it's really evolved rapidly over the past 15 to 20 years.
It has.
Products
I love the term you use, divine intervention for you. So like this type of alternate career path. But present day numbers, as we fast forward to today, roughly about 33 million patients diagnosed with diabetes, and roughly 85 or so million that are pre-diabetic.
Exactly.
So a little over 1/3 of our just U.S. population. Those are staggering numbers.
They are. I mean, I try and comprehend what a million of anything really is when you start to look at it. So this is mind-blowing, and knowing that it's not just in the U.S. either. It's going on everywhere. Middle East, Latin America, India, you name it. It's just everywhere. Africa. I mean, the people that contact us and reach out to us for the Save a Leg, Save a Life Foundation, they literally come from all over the world.
So I'd like to pivot to that, because as we talk about these staggering numbers, and you in your clinical practice see patients, even though there's a lot of discussion as to what could eventually help follow many patients on the preventative track to treating what they may have better, the numbers continue to be alarming and staggering.
Yes.
Which is why innovation will cultivate what manifests to hopefully better treatment options. SANUWAVE has the dermaPACE device, but talk to me a little bit about what led to the passion cultivated to Save a Limb, Save a Life Foundation?
Well, just I think really from day-to-day practice and seeing what my patients were going through and kind of the parallel that we've learned about the 5-year mortality rates with cancers. And I saw firsthand, and I've seen firsthand, continue to do so, the emotional roller coaster, the toll it takes on not only an individual, but also their family or support team. And so we have this disease and all the complications and bad things that go with it, and it seems to not get enough attention. And so much of it is preventable in a sense. So seeing things that would come into my practice, though, really spurred the idea of trying to educate more in our community back in Jacksonville. So just seeing even a disconnect between the home health area and understanding of wounds and who was writing orders for wound care and the state that patients would come into my practice. So I said, we have to do something. We've got to start teaching people in our community and start bringing people together who are like-minded and understand what's at stake and go from there. And really, ultimately, at the end of the day, we really have to get this message out to the public because that's who has not gotten the message.
How would you grade the foundation as well as giving objectives, getting this message out to more, increasing awareness around it, that there are controllable things that could change the trajectory of the alarming and staggering numbers that we referenced earlier? How do you think we've done?
Yeah, well, as far as the foundation goes, I think we have not nearly come close to where we need to be. We know the problem that exists. We know who's not getting the message, and here we are at a conference like the SAWC, and we're kind of speaking to the choir and are preaching to the choir. We all get it. We understand what's going on out there, but why has this message not gotten out to the public? So, this is one of our objectives, part of our mission and vision. It's about education. It's about patient advocacy, community outreach, and this is how we start to get the word out. So, we've been successful. We, in certain areas, we're only 5 years into this now, not even 5 years. And to be a nonprofit organization, it takes a while to get established. And it's kind of like a chicken and the egg thing. It's like you have things you want to do. It takes some funding to get things going. But how do you ask people for funding when you haven't been able to demonstrate anything yet? So we're finally getting there. We're starting to do some good things between patient assistance program that we've created where we help people get diabetic shoes and inserts or supplies or things like of that nature. We've started a scholarship program through the American Board of Wound Management Foundation as well.
That's great.
And that was in memory of one of my patients, and I promised him that I would not forget him. And this is the type of thing that it starts with a small thing, but eventually it will grow.
It becomes a movement.
Yes, and I'm just kind of proud of the fact that the name of our organization is starting to become part of the lexicon. And this is what we had hoped it would be. I see kind of little variations of our name used in all sorts of materials now. And so that's gratifying, but it just shows that we have to really take charge and be the leader in this. And we're gonna be the banner that everybody can follow and be underneath too.
Well, SANUWAVE certainly admires and respects you, so we're proud to be a champion, supporter in whatever you determine needs to be able to intervene and support that continued movement. And I know many industry leaders as well that would love to get behind this. So we're happy to support you. We look forward to continuing to support you in whatever trajectory that may be. Real quick, in a closing question, what ideally do you see 5 years from now?
Wow, that's a great question. I see us really becoming a household name. I see us getting involvement and support from major organizations to be on the wound care arena. Because again, driving this to the public, I see things like Major League Baseball as an example. We started our White Sox campaign where we are trying to draw attention to the lower extremities, and that's really
as indicated by the logo here
yes.
on his lapel.
Yes, and this is an idea that we felt, using social media, we could start to get the word around globally as well as locally. But a team like the Chicago White Sox, as an example, is a perfect segue to get us, a higher profile audience, and I believe it'll go from there. And certainly, I see us doing more in terms of community outreach and patient assistance too, in a scheme that's so much larger than where we are now. You know, I look at the Komen Foundation. It started as a promise from one sister to another, and yet here we have something that's so much larger in scale in terms of people with diabetes are affected with this terrible disease, and we have this ability and we have the resources, but we just have to put it all together.
Yeah, well said. One thing that I noticed was absent is funds, money, and I appreciate the authentic answer that this is a movement that needs to be created by us coalescing more together, clinicians, payers, providers, industry leaders, etc., to really tackle this.
Yes.
And then the cost avoidance of what amputations would be a significant impact to
Absolutely.
what is ailing the healthcare.
Yes, I think if we can, do this on the front end and do more teaching and have more resources for patients and people to understand what's at stake and things that they can do to be proactive in their own care, then it's money well spent. Right now where we are too as an organization, we're all volunteers. So, I'm the rate limiting step of all this, but part of my goal is to be able to hire and create jobs within the organization, and then we can really expand this and take it where it needs to be.
Much higher level. Education and awareness.
Absolutely.
We stand with you on that. Dr. Bell, thank you very much for your time.
Appreciate it. I appreciate it very much too. Thank you for all your support.
Closer to your 5 years.
Thank you.
Take care. Thanks very much.